Look out now. Don't stare at me too long. You might turn into stone. Live from your mama's porch. People of the world, what's going on? Y'all know who I be. I am the Riri, owner of Willpower to Wellness. I am a health, wellness, mindset coach. I empower women, your mama, your sister, your cousin, your baby, your auntie, everybody to take charge of their health. They don't know how to put that same energy they put into everybody else into loving themselves first. That's what I do. Fitness, yoga, nutrition, meditation, mindset shift. That's what I do. That's what I'm good at. Hit me up for a consult. My apologies for this delay here for this February National Unawareness Month. February is National Heart Health Awareness Month. But February is also Black History. Check my dress. This is a dress that I got on. This isn't a shirt. This is a dress with pockets. Hello. Come on now. Every time I find a dress, I always try and find a dress with pockets in it. That way I can like just boom. Just thugging it. Strong, Black, educated. Oh, I did it on this side. Oh, that was ghetto. Strong, Black, educated, blessed woman. You feel me? My Black is beautiful. My Black is educated. My Black is powerful, strong, resilient, all of the above. I love me. I love my Black. I love my womanhood. That is me. Black is me. Me is Black. Boom. July. Not only is it Black History Month, I'm finding that it's Creative Romance Month. But it makes sense because February is also the month for Valentine's Day. Yay, Valentine's Day. You know, I got my curls going, you know, for Valentine's. I ain't doing the curls for nobody. I'm single, but February 14th is my spirit mom's birthday. Hi, Misa, I love you. I'm getting ready to see her for her birthday this weekend. Reason why I'm pre-recording this and releasing it to y'all to enjoy and learn from at your own convenience, you know? Now look here, National Marijuana Month. That not sober giggle is funny, but I don't smoke. I don't partake in smoking, nothing like that. That ain't me. But remember I told y'all back in November when I did Diabetes Awareness Month, keep a lookout for my CBD Cool Rub. This here, this rub. You will have a tingle running down your spine. Oh, beeswax, same as my candle here. Buy my candle. This is Dire Desire, by the way. Vanilla, rose, jasmine, lemon, orange. This is full spectrum CBD. I'm not advertising. I'm just letting you know it's not on the market yet because I do not have the licenses in Texas to sell this yet. So keep a lookout. This is going to help your pain. Any wounds you might have that needs to heal. It has beeswax, sweet almond oil, coconut oil, lavender, eucalyptus, lemon. Oh, it's going to get you right. And a secret ingredient. I'm not going to tell y'all because it's a secret. And if I give everything away of this thing, y'all are going to figure it out. You're going to make it on your own. I ain't going to make no money. Don't do me like that. I got to make some coins. But yes, CBD cool rub for pain. This is not FDA approved. I'm not advertising as I am a doctor or a pharmacist or anything. So keep that in mind. I'm just gonna hide this out of sight, out of mind. Be responsible. Be aware, especially in your state if it's not legal. Y'all already know. And then in Colorado and Oklahoma, whatever, I don't care about y'all, whatever. Y'all make me sick. We'll get to y'all's level one of these days. It's all right. Texas will catch up. Spiritual Wellness Month. Know yourself. Know you. Figure out yourself spiritually. Know what will get you closer to your higher self, your inner child. Heal old wounds. That way you can get to where you need to be. That way you can reach your destiny. Be successful. Gain abundance. Get clarity. All of the above. Yes. If you have experienced spiritual awakening, it's a pretty good view up here. Just saying. I'll show you. Children's Mental Health Month. Love yourself first. Or however, your children are a part of you. When I say love yourself first, your children are included. Your children are you. Okay? They come from you, whether they come from your womb, whether they come from your male parts, they come from you. They are you. They are a part of you. Love them like they love yourself. However, if you don't love yourself, you need to get that under control. You need to love your children and pay attention to any signs of any mental distress. Because children, even though they're children and they don't have as many stressors as us adults do, pay attention to your kids. Sit and talk to your kids. Talk to them and ask them how their day has been. Ask them if they've played with their friends today, if they've talked to their friends today, if they learned something at school today. Ask them how they're feeling. Hug them, love on them, kiss them, tell them you love them, and make sure that they know that you love them. Real talk, because our kids, a lot of us, as we were growing up, we were not shown that loving, unconditional love. I mean, we were taken care of. I mean, we've come here where we've come this far, but we got to break that. We got to break that cycle. We need to hug on them and love them and give them kisses on their cheeks and tell them that we love them and we will be there for them no matter what. And that's important, because if we don't show that love to our kids while they're children and they don't build that relationship with their mother and their father, that will carry on to when they become adults and they find their husband and their wife, and that can affect their relationships, their working relationships, their relationships with their friends, their kids. That's important. That's love on your kids and show them that love goes a long way. Love goes a long, long, long way. I tell my son every day, I love you, my sweet cub. I have to get my hugs and kisses from you every day. And this is required before I put food in my stomach. That's how much I love my baby. And that's how much I need my son. Period. Eating disorders month. Anorexia, bulimia, things like that. When you're too skinny, when you are, eating too much. You can eat too much due to stress. You can eat too much due to, a comfort thing. And that should be addressed because it can be a mental health condition. It could be, just a cry because you're somebody, that person whoever is eating too much or too little. That's a self-confidence, self-esteem issue for sure. That's why I say love yourself, know your body, know your mind, know your soul, pay attention, and you will be able to go from there without a doubt. All right, moving on. National Heart Health Awareness Month. The color is red. I've been wearing a lot of red lately. It's all good. My favorite color is not red. My favorite color is actually blue, green, purples, brown, gray, stuff like that. But red is a color of passion. Red is a color of protection. Red is a color of, love, color of your blood. That's, embrace the color red. I used to could not stand red. I wasn't gang banging or nothing, but I just didn't like to look at the color red because when I get mad, it's all I see is the color red. So that's something I had to clear up within myself to clear my mind of my perception of that color. So, not saying that red is my favorite color now, but red is a part of my wardrobe now. So, the heart's anatomy. It's located between the lungs, a little to the left behind your sternum, your breastbone right here. So it will be like right over here, around here in this area, right in your mid chest. And your heart beats. It expands and it contracts. Expand, contract. Boom, 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 boom. That's your heart. Your daily heartbeat average. Your heart, the adult heart, it averages heartbeats 100,000 times per day, helping it to pump 2,000 gallons of blood. In a long life, your heart beats more than 3.5 billion times. An expansion and a contraction, boom, boom, that's one beat. Boom, beat, boom, beat. That's not how that works. Boom, boom, that's a beat, heartbeat. 3.5 billion times in your life. I heard from somewhere that you have a certain number of beats that's issued to you in your lifetime. So don't do anything to speed up your heartbeats or to slow it down too much. Or what I take from it, don't rush into adulthood. And I feel that for sure. So the heart size, it weighs between 7 and 15 ounces. So it is your fist with your hand wrapped around it. This is your heart. This is how big your heart is. Boom, 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 Right in the middle of your chest, a little to the left. Boom, 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 boom. That is your heart. Your heart is a part of the cardiovascular system. That is your heart and the arteries, the veins, the capillaries, the everything that helps your heart to pump blood throughout your whole body. That way your whole body can get the nutrients that it needs. And, you know, your immune system goes throughout your body to help your body heal, to help your body get oxygen, to help your body to get all that good stuff into your cells. That way your cells can heal. That way your cells can multiply and build and, heal the body. That is what our heart does. That's what our blood is responsible for, to carry that oxygen and nutrients and water. Water builds our blood. Water is necessary for our hearts to function. Water is necessary. Beats at a normal heart rate. That is very important. If we do not have enough water in our body, we become dehydrated. What it look like when we are not hydrated enough? Our heartbeat will fever, huge fever. Your body regulates its own temperature, and if it cannot regulate its temperature, it's just going to go up. And if your fever is too high, then it can damage your organs. Your heart rate will beat faster than it needs to in order to get this blood, the blood that it can get flowing around your body with the little bit of water that it's got. And that's not a good thing. You need water throughout your body. 64 ounces of water needs to be consumed every day. That is important. Or at least half of your body weight in ounces of water per day. And I will say this in every daggum video: please drink water. If you don't do nothing else, drink enough water for yourself to function the way that it needs to. You got me? Get it? Got it? Good. Now, heart and circulatory system makes the cardiovascular system, like I said, as a pump that pushes blood to the organs, tissues, and cells in your body, oxygen, immunity, nutrients, etc., necessary, etc. It's two sections to the heart, top part, and it's separated by valves. And there's a left and a right. This is my left and this is my right. The left atrium, the right atrium. And then there's the left ventricle and then the right ventricle. Blood leaves the heart through the arteries and the capillaries, which comes out of the atrium and returns to the heart. The blood returns to the heart through your veins, through your ventricles. The biggest part of your heart is I believe it is the left ventricle at the very bottom of your heart, left side. Now, it extends. If you take every vein, artery, vein, capillary, all the pathways that your blood goes through your body, and it extends, and you line it up in a line, tie it together, and wrap it and extend it out, your circulatory system will wrap around the earth twice. You cannot tell me you're not larger than life. Come on now. Yes, we are powerful. We have veins and arteries and everything that stretches out and will wrap around the earth twice. That's a lot of length of veins and capillaries and everything that make sure that our blood and nutrients and everything comes around our body, through our body. That way the cells gets the nutrients that it needs, the oxygen that it needs. That way we can breathe, build our muscle, excrete waste. That way we can, do what we need to do so we can stay healthy, build our immune system, everything like that. Our blood is powerful. Our heart is powerful. That is the cardiovascular system. Now, the conduction system. I know y'all are saying, Reed, you just said conduction. When you say conduction, that means electricity. Yes, my friends, conduction, electricity. Electrical impulses come from your heart muscle, which is called the myocardium, which causes the heart to contract. That second beat, that's a contraction, meaning it's shrinking to pump blood through the body. When it's, it's getting the heart, it's getting the blood into the heart. Boom. It's taking blood out of the heart. The sinoatrial node, that is the natural pacemaker. When somebody says they have a pacemaker and they can't be around a microwave, those artificial pacemakers they put in the body to make sure that the electrical impulses are making the heart beat like it should. So we have electricity in our bodies. The SA node is the natural pacemaker in our body. So we have a pacemaker, but it's an actual muscle, and it's located on the top right part of our heart, right up here. So in the right atrium, so to say. So remember where I say where the heart is. It's right in the middle of the chest, a little to the left. So that means the right atrium would be right here. And that means it's right in the middle of the chest. It's beautiful. That is absolutely beautiful. Electricity. That is energy. Energy, folks. We hold energy. Our soul is right dead in there. Energy. Life. What is that law of thermodynamics? Energy cannot be created nor destroyed, but it is transferred or transformed into a different form. It's transferred from one form to another. And this was first proposed and tested by Emily du Châtelet. This is a French aristocrat, which is also a woman. Impulses are sent at a certain rate, but your heart can still change depending on physical demands, stress, hormone factors, things like that. So that's a big one. So it's not a big mass of muscles and cells and tissue and we're not just a big blob on this earth. We are a radiating form of energy walking this earth, and we all have a purpose. Once we leave this earth, once we leave this earth, where is our electricity going to go? Where is it going to go? It has to be transferred to go somewhere. So that's just my thought. I'm not, discrediting any other religions here, Muslim, Christianity, or anything like that. However, when you get shocked, it goes into your body, and if it's too much electricity, it can disengage your the SA node, and it can cause you to lose your life. But the energy that's already within you is not going to stay there. Your body is no longer functional. So where is that energy going to go? To a different plane, to find another form in order for it to continue to survive. Period. All right, so I have to give this disclaimer real quick. I ain't your doctor, all right? I cannot diagnose. I cannot assess. I cannot prescribe any medications. However, I am a medical assistant. I have been a medical assistant registered since September 2014. I have worked in doctor's offices in primary care, in neuropathy clinics, wound care, ortho clinics, and neurospine surgery clinics. Do not come to me for any medical advice. I cannot prescribe anything to you. I cannot assess. I can't tell you, oh, you got foot fungus. You can just do this and this and this. I can't tell you none of that. I can just give you information that's already on the internet that is free 99, available to anybody that searches it, as long as you search for credible sources. So all of this information that I'm giving to you is for informational purposes only. So do with it what you will. You hear me? Now, heart disorders, coronary artery disease. That is a pretty common illness that people, experience, and it's a pretty broad term, because coronary artery disease can be anything. It can be, it can lead to acute issues like heart attacks or cardiac arrest or stroke, certain types of strokes, things like that. But coronary artery disease, it describes numerous disorders of the heart and blood vessels, like heart rhythm disorders, which is known as arrhythmias, an irregularity in the heartbeat. Boop, 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 boop. Just irregular, like it's not beating at a normal rate, or it's beating out of your chest, like you don't want them issues at all. It's scary, and you can, yeah. Birth defects of the heart, that's something that someone can be born with. They can be born and they can have a congenital heart disease. That's something that's found at birth. Those are managed by board certified cardiologists who specialize in heart and vein disorders. Now, there are vascular specialists who are, they're like subspecialists that get a referral from a cardiologist. That way, if somebody has varicose veins, they have veins that are literally like just sitting on their skin, and it's painful, and it's like blue lines with veins on their legs. It can be very painful. A cardiologist will refer that patient to a vascular surgeon or specialist. That way they can correct that issue. So those are the types of specialists that deals with those type of issues. Now, CAD is known to be a condition in which plaque made of fat, cholesterol, calcium, other substances in the blood, it builds up inside the coronary arteries, which supply oxygen-rich blood to the heart muscle. This plaque buildup is called atherosclerosis. Oh, I said that beautifully. Oh, I'm awesome. I am a G. Plaque can grow large enough to reduce or completely block blood flow through an artery. Or it can rupture, causing a blood clot to form that either blocks the artery or break off and travel somewhere else in the body, causing a blood clot somewhere else into the body. And that's not a good thing. When a blood vessel that feeds the heart, when it's in a blood vessel that feeds the heart, it can result in a myocardial infarction. Y'all know what that is? Medical abbreviation MI. Myocardial infarction is another word, which is a medical term for a heart attack. It's depending on the severity, sudden cardiac death, cardiac arrest, to where the heart is not getting any oxygen to the heart muscle. And when the heart doesn't get enough oxygen in the muscle, it will cause the cells in the heart to die and eventually stop. Now, there's also a disorder called carotid artery disease. Now, carotid artery disease is where you have a blockage or plaque buildup in your neck, the carotid arteries in your neck. Now, so in carotid arteries on either side of the neck, carotid artery disease can cause a stroke if you are not careful. So that is very serious. Now, there's also peripheral artery disease. Now, this is when the major arteries that supply blood to the legs, the arms, or the pelvis are blocked or obstructed. So when you think of peripheral, you're thinking peripheral vision, like you can see, you can look straight ahead, but you can see on the side of your eyes. When you're looking forward, it's that sideways view. So the sideways view of the body are the limbs, the arms, the legs, and they consider the pelvis in this case. If there's any major arteries in those areas that are blocked or obstructed, it can cause numbness, pain, and or infections like gangrene. And that ain't fun and that ain't cute either. If you find a gangrene leg, ooh, I feel for this patient. I've like I said in another video, I've had to help treat a patient who had, a really bad infection in one of their legs, and they had ulcers and they had, just cracking and like numbness. They couldn't feel when I flicked their toe. They could not feel that. And it's sad. And they already had one leg amputated from the same thing. And that can be caused by neuropathy from diabetes or idiopathic peripheral neuropathy, where it's just caused by just poor diet or from anything that can cause it. If you don't take care of yourself, is basically the first things that go with nerve conditions are your limbs. The nerves in your limbs, peripheral neuropathy. Now, symptoms. I'm going to give a general description of common cardiovascular acute symptoms that somebody would experience that would alert them to get some medical attention immediately. And then especially if you've been feeling these symptoms for a long time, that is definitely an indicator to get some help for sure. Now, I wrote these down. I asked any patient when I was working in the doctor's office, somebody comes in and they've been feeling like chest pain. Let's say they've been feeling chest pain on and off for, let's say, a few days. I'd ask them, okay, you've had chest pain. Where do you feel the chest pain? You feel it in the middle of your chest? Do you feel it on the left, right side? Do you feel it like in your upper stomach? Because sometimes, and I wanted to make a note of this too, sometimes when somebody complains of chest pain, it's not always a heart attack. They would have that chest pain, but it can be like in the sternum, and it can just be inflammation in that sternum area. And when they cough, they'll feel like a soreness in their chest. And when they have that soreness and possible inflammation in that sternum or the breastbone, that's a condition called costochondritis. And I think I said that right. I hope I said that right. And if I did, I am a G. But that is the term, costochondritis, where you have an inflammation in your breastbone. So that does not mean you're having a heart attack, but when you see a physician, they will confirm that with you. They'll do an EKG test on you, or I would do that EKG test on you to check to see if there's any irregularity in your beat, if there's any, anything. A lot of things can be found in an EKG for the heart. But I asked them, do you have any shortness of breath? That's another symptom. You have shortness of breath, and it's worse when you walk because when you walk, you need air to walk and to function and all that. But when you feel better when you're sitting down, when you're talking too long, you might feel shortness of breath. There's also, you can feel lightheaded or dizzy. That's typically felt when your blood pressure is too low. So that can be something there. Feeling anxiety, restless, or impending doom. And that's kind of dark to think about, but that's one symptom that patients tend to feel when they are experiencing a heart attack, is anxious, like the cortisol's pumping through their body through the adrenaline. That can make somebody feel anxious. Cyanosis. Cyanosis is a term that describes, a bluish tint in the skin, bluish in your hands, your feet, and on your lips, in your face. You're just turning blue because you're not getting any air in your body. So that is a sign too. Your heart is pounding out of your chest, pounding or an irregular heartbeat, and then sometimes your heart will skip a beat. That can be a sign too. That can be another sign that something's going on with with your heart, your arteries, or your valves, one of them. Loss of consciousness, disorientation, resembling in a stroke, a certain type of stroke. Edema, which is another word for swelling. If you've been experiencing swelling in your hands, more common in your feet, in your ankles, you notice swelling. That's your water in your body, magnifying or sticking to the salt in your body. The sodium in the water travels downward with gravity, so it sticks with your. I just went blank about your ankles. Your ankles, your feet will be swollen. You will look like you are 9 months pregnant by the feet. It's not cute. It's not funny, but that is a symptom of a cardiovascular issue that needs some attention. So those are some common symptoms. Now, with a heart attack specifically, you will feel a pain in your chest. Sometimes you won't feel a pain in your chest. And it's actually shown that 1 out of every 3 people with a heart attack, they don't have chest pain at all. They will feel pain shooting up their neck or in their back or coming down their arms or anything like that. And another symptom would be, gas like pain in the stomach. And that's another thing too. When you feel gas in your stomach, like it's a gas feeling, sometimes it could be a heart attack, but more commonly it could be heartburn. Could be heartburn. And I've had one patient that was scared that he was having a heart attack. He doesn't have any history of a heart attack. However, he said that when he laid down, when he was laying down on his recliner and, he reclined his seat, his pain would be worse. And when he would sit up, the pain would be better. And I would ask him, okay, did you eat anything before you went to sleep? And then he would probably say, yeah. And I'd ask him, is he smoking? And smoking would worsen it. He would say, yeah, because it can be GERD, gastroesophageal reflux disease. There it is, gastroesophageal reflux disease, where the valve going to your stomach is not closing all the way. And that is caused by diet. It can be caused by stress. It can be caused by your stomach acid, and it'll come up your esophagus, and it can cause erosion. It can cause erosion, meaning ulcers in your esophagus, causing pain when you lay down and after you eat fatty foods, salt, sodium-rich foods, that can worsen that pain. So when it's in the esophagus, it's not a heart attack. You just need to take some Pepcid or something, and possibly if it's in a very severe state, you might need to do an endoscopy with a gastroenterologist to get treatment for that. So it might not be a heart attack. It can be GERD. It might not be a heart attack. It could be costochondritis. It might not be a heart attack, but it could be an aneurysm. And I'm not wishing that on anybody, but definitely watch out for symptoms for that. Those are symptoms of a heart attack. Like I said, gas-like pain in the stomach, which could be mistaken for indigestion, but probably won't improve with rest or a nitrostat pill. A nitrostat pill is nitrostat is the brand name for the scientific name, nitroglycerin, which is a medication that is prescribed and given as needed to patients, and they should be taking it every 15 minutes when they feel chest pain to help them if they are having a heart attack. And it is something that is similar to aspirin. So when somebody says, oh, I take aspirin 81 milligrams every day, a baby aspirin, they take that every day to help to thin the blood, to make sure that the blood is not clotting, that it helps to break down the plaque that's in your blood and make sure that it's going through your blood vessels and your arteries and everything a-okay, easier. So that's what that is. Nitrostat helps with heart attacks, temporarily until you can get that immediate medical attention. So I know this is a lot of science. I'm sorry. I'm used to all this. But this is something that we need to know as a people, because we are disproportionately affected by heart disease. Heart disease is the number one cause of death in the Black community. So we're going to get this work today. You hear me? We're going to get this education. Now, cardiac arrest. That means your heart unexpectedly stops beating. It just stops, period. It can strike seemingly healthy people of all ages, even children and teenagers, just all of a sudden. But I've noticed specifically that, really athletic people can do this, can experience cardiac arrest because too much work of the heart, way too much work of the heart. They're running back and forth like on the soccer field. You notice a lot of soccer players passing out on the field because their heart is overworked, and they find the coroner finds that the soccer player would pass away from cardiomyopathy. I believe that's the term for it, but that's a disease of the heart, and when it's overworked, it can make it stop working. Heart failure. So, not to scare you or anything, but I'm just giving you this education so you can know, be mindful, and keep your doctor's appointments. Now, symptoms of cardiac arrest. I have not encountered anybody that's had cardiac arrest, but somebody that has cardiac arrest, you would notice that they would become unresponsive. They're not breathing. You might notice them snoring, like they're sleeping, or having a seizure, and that's a very scary thing. It can lead to death within minutes if the person does not receive immediate help, because when they're not breathing, when they're not responsive, they're losing oxygen to the brain. And when the brain loses oxygen, it can cause brain damage that can be irreversible if you do not get medical attention quick enough. And on that note, move out the way when the ambulance comes. Please move out the way. Pull over and let the ambulance go. 1 second can make a difference. Please let them over. And then that is a crime if you do not pull over for an ambulance or police car, any vehicle that has a siren. And of course, if it's a vehicle that can legally have a siren, pull over for them. That way they can go through and it can possibly save a life. Honestly, it's very important. Now, strokes. Strokes are known to be a neurological condition that's acute, but I put this one down because it's not related to the heart, but it's still important. Ischemic strokes. Most strokes, or 87% of strokes, are ischemic. That means it happens when blood flow through the artery that supplies oxygen-rich blood to the brain is blocked. So we need to know, because the brain needs oxygen, it needs blood to function. That way you can think, that way you can, if you have no brain and no heart, you have no life, period. Literally, you need a brain and you need a heart that is functioning properly to live this life on earth. So that's one type of stroke, an ischemic stroke, or in another term, science terms, cerebrovascular ischemic accident. Boom. That is a stroke. Now, that's one type. Now, there's a hemorrhaging stroke where one of your blood vessels in your brain bursts and the hemorrhage, the blood goes all through the brain and it damages the brain. That's dangerous. That's not as common as an ischemic stroke, but that's something to understand. Symptoms of that. Okay, I'm going to stand straight. That way you can see what I'm demonstrating. Somebody has numbness or drooping in their body on one side of their face. If they have drooping on one side of the face, like their eye won't open, their face just droops, their mouth is drooping, and they might be drooling and they can't talk. If they try and lift up their arm and then their arm droops, they can't move one side of the body. If it's my left side of my body that's drooping, that means that there is an issue on my right side of my brain. So if there's something in the right side of my brain that's affected, it will affect the left side of my body. If my right brain is healthy, then my left side is healthy. Period. Same way, other way. That's important. Now, if they can't talk properly, if they can't comprehend what you're saying properly, if they seem disoriented, if they can't see out of one eye. Sometimes somebody can have a stroke on both sides of their head, and that is very unfortunate and dangerous. And people need to know what to do if somebody is experiencing something like that. Severe headache, that's another one too. If somebody is telling you, if somebody can communicate with you that, and they're having a stroke, and they can communicate with you, ask them, are you having a headache? Are you okay? Can you talk to me? What's going on? Notice if they can lift their arm up. Notice if they can talk. Look at their face. If they can open their left eye, their right eye, if they can talk with their mouth and one side of their mouth isn't drooping, that's important too. Please, please, please make sure you can get those signs, because the ambulance, the paramedics is going to ask you those details. That way they can properly treat this patient as they take them to the hospital, so they can possibly save that person's life. Now, who is at risk for getting heart disease? If you have high blood pressure, which is known as hypertension, if your blood pressure is anything over 140 over 90, that is considered high. Now, if you have this high level for an extended period of time, that would be considered hypertension. But if you have a 140 over 90 blood pressure and it's just for that certain time, it could be due to you being in distress, you being hurt, you being in a stressful situation, a panic attack, anxiety attack, things like that. It's only temporary, which is normal for, an average person to have a spike in blood pressure, like, for example, after a car accident. That would spike anybody's blood pressure. That's just what happens. Another risk factor, if you have a history of high cholesterol, if you're eating way too many fatty foods, way too many fast food, processed foods with preservatives and things like that, stuff that has way too much saturated fats that will clog up your arteries. It's no good. If you smoke, oh my God. Like, if you smoke, stop smoking. Like, I absolutely hate smoking so much. I cannot stand the smell of cigarette smoke. I grew up around it and I had to get used to it because that's just how it was. But smoking tobacco has no benefit. It's a dangerous and addictive habit, but it's no good for anybody. And there's people out here that's been smoking for 40, 50 years, and you cannot tell them nothing. Try telling a Black, somebody elderly, somebody Black, and then tell somebody who is an elderly Black woman to stop smoking. Just tell them to do something, period. And tell me, come back to me and tell me how that works out for you. I would love to see that. But on a serious note, you have to stop smoking. You have to stop smoking. Period. It's no benefit. All it's going to do is just tear everybody from the inside out. Makes you age faster. I don't want wrinkles all on my face and stuff. I'm too pretty and cute for that. That's ghetto. I don't want them problems. If you have a history of recreational drug or alcohol abuse, that can put a strain on your heart. Your age, if you're older, I believe it's 50 years of age and older. Also, family history. If you have a family history of a heart issue, like a congenital heart issue, or just development of heart issues over time due to lifestyle habits, food intake, exercise, that can increase your risk of developing heart disease later in life. Your race. Black folks love seasoning. Black folks love seasoning. We love to season our food, and we will season our food more than the law allow. And I love my Creole food. I love my jambalaya. I love my brisket. I love anything that's anything that tastes good and well seasoned and flavorful. It's going to have a lot of salt in it, unless you can find somebody that does not use a lot of salt, sodium, and can make it taste flavorful. Like they love garlic. They love the Trinity, the bell pepper, the garlic, the onion, stuff like that. But they don't use a lot of salt. I don't know what they do. I don't know what type of sorcery they do to make food like that. But let me know something, because I don't want heart problems. I love my heart too much. I don't want them problems. I don't want it. But us as a people, we love seasoning, and too much seasoning or salt can mess us up. Low levels of physical activity and poor diet. And also a health history of diabetes, or if you have a history of obesity, that can put a strain on your heart. When your blood pressure is high for an extended period of time, that can enlarge your heart. Your heart will be bigger than it normally would, and that would be because your heart is working harder to put blood throughout your body, and Your heart is eventually going to get tired, and your heart is going to say, look, fam, I'm through and I'm fin to give it up. So change it now or it's game over. Period. Now, in the Black community, and I'm going to cut this short as much as I can. It's already an hour. In the Black community, I'm going to throw some numbers at you. Like I said earlier, heart disease is the leading cause of death in the Black community. Nearly 50,000 people die each year from heart disease. Black people. 49% of 20-year-olds and older have heart disease. Did y'all hear what I just said? 49% of people 20 years of age and older have heart disease. You can have heart disease and you don't know it, fam. When was the last time you've been to the doctor and the doctor has checked your heart? Do you know how healthy your heart is? Are you short of breath very often? How your feet look? When you take off your socks, is there an indentation in your socks that's not normal? Or are your socks just too small? 50% of people who have heart disease are aware of signs of a heart attack. 1 in 5 people believe they're personally at risk. And this is the Black woman that I'm talking about. 50% of Black women are aware of signs of a heart attack. 1 in 5 believe she's personally at risk. Only 36% of Black women know heart disease is their greatest health risk. So they've gotten that education and they know that they need to slow down and get some more exercise to get their heart pumping and, healthy, to lose that weight that they need to lose, to break up the plaque that's in their body, to just live a heart healthy life. They know it, but some of them don't take the action to change. Now, treatments. This is a lot. There's a lot of medications that are prescribed by physicians to help with blood pressure, to help with heart failure, to help with different heart issues. I'm not going to name all of them, but very, very common medications that are prescribed in the doctor's office are like simvastatin. I know y'all know of this one, lisinopril. Not a lot of us react too well to this medication. So there are other options if you choose to take medication for blood pressure, because blood pressure has something to do with the heart. If your heart is working too hard, it's not a good thing. But diuretics, that's the water pill that would be attached to a high blood pressure medication to help your body to release any excess fluid that might be in your body, any excess salt that's in your body. One common medication that's prescribed would be, and I know this term, I used to say this word every day, hydrochlorothiazide. Hydrochlorothiazide, or the abbreviation HCTZ, that would be attached to a blood pressure medication to help to bring the blood pressure down by helping directly with the heart while also working with the kidneys to excrete any excess water or sodium. Boom. Also, labetalol, atenolol, any beta blockers. Those are beta blockers. Now, I'm giving you the names of these medications because these are the most common medications that are prescribed by your doctor, by your cardiologist, or your primary care provider. However, it all depends on your physician's physical exam. Don't go to the doctor and say, hey, I think my blood pressure is high. Can you prescribe me some atorvastatin? Atorvastatin is for your cholesterol. Atorvastatin, when you take a medication, I'm skipping over, but when you take a medication for cholesterol, you are taking a medication to help reduce your LDL cholesterol levels, which is called your low density lipid. LDL, low density lipid, which is your bad cholesterol level. There's HDL, which is high density cholesterol. That's good. And then your LDL, low density lipid cholesterol level, which is your bad cholesterol. Atorvastatin or any statins, anything with statin at the end of the name of the medication, that is prescribed to lower your bad cholesterol levels, along with good diet and exercise. So that's for cholesterol. That is another medication that's prescribed to help with the heart and to help with, your arteries and your, clearing up the plaque. Now, I gave you some cholesterol medications and blood pressure medications. The small things, when you have high cholesterol in your blood, or if your blood pressure is high, those are indicators that something needs to change. Just because you take a medication for your blood pressure or cholesterol, that does not mean you can just take this medication every day and you don't have to change your diet or your exercise habits. That is not what that means at all. If you are trying to get off of these medications, you have to take the medication as prescribed by your provider, while also eating healthier, taking saturated fats out of your diet, margarine, anything that will harden at room temperature does not need to go in your body at all, because it'll clog in your arteries and it'll block your blood from flowing where it needs to go. So don't throw margarine away. Limit your butter intake. If you have to cook with butter, cook with more olive oil, cook with more canola oil. I would stay away from vegetable oil because that's not the healthiest type of oil to cook with. I don't buy vegetable oil. I have not bought vegetable oil in over 10 years. I don't buy vegetable oil. I'm bougie, and I will buy canola oil because it's healthier. It is healthier, and olive oil is healthier, and actually butter is healthier. But do not go crazy with butter. Paula Deen, butter does not go in everything. You heard me. Who gonna pop me? Butter's so good though. I ain't gonna lie to you. Cut your cheese intake too. And I keep telling myself, man, cheese is gonna be the death of me. I love mozzarella. I love Parmesan. I love cheese in my my chili cheese Fritos, and I'm a mess. But this health coach knows how to limit stuff that does not need to be in my body in excess. So those are prescribed medications that a doctor would prescribe you to help you with your efforts to lower your cholesterol and blood pressure levels. That way he can wean you off of those medications. That way you can live a healthy life without having to take them for the rest of your life. If you just want to take them for the rest of your life, then you do you, boo. But I'm not going to take 20 pills per day. And no, who wants to swallow that many pills per day? Make that make sense. Now, there's also herbs. Good old herbs. Natural, healthy herbs. Come from the ground. Natural alternatives. I'm not exactly sure of the specific herbs that are typically taken for blood pressure and cholesterol and other heart issues, but contact an herbalist, a credible herbalist that can give you advice for that if you don't want to see a primary care provider in a doctor's office. See somebody to help you know you, okay, inside and out. Because don't just go out here and just live in your life and be like, I'm fine. Next thing you know, cardiac arrest out of nowhere. You wake up and you are, you ain't gonna see nobody no more, and nobody's gonna see you no more. Real talk. If you have heart failure that's so bad that a cardiologist would recommend that you get a heart transplant. And that's the only way that you can live another day on this earth. An option, you would probably be put on a wait list depending on your depending on your wealth status. People out here getting 6, 7 hearts transplanted in their life, and they living to be 120, 130 years old. I ain't say nothing out loud, but transplant can be an option. Bypass surgery can be an option, to where they would do an open heart surgery to see what is causing these issues and fix it. It might be a valve, it might be something else. There's also an angioplasty, which us folk know when you get a stent put in your heart or in an artery, to open up that artery of any plaque or any buildup that might have made your artery to close up a certain percentage, and you find yourself short of breath, chest pain, you can't walk nowhere without being short of breath. It's not cute. You got to get it together. Other surgeries that helps with feeling better. Treatments, like I said earlier, aspirin. Excuse me. Aspirin is a medication that can be given to somebody who has a stroke. Now, I wanted to tell you this too. Those two different types of stroke, ischemic and hemorrhagic, one of them. I would recommend, and according to my instructor who gave me my CPR certification, if you find somebody who has an stroke, you can give them an aspirin. I believe it's and don't look it up for yourself. Get guidance from somebody who is certified. I'm certified too, but I forgot totally how much aspirin you give somebody if they have an ischemic stroke. But if they have that type of stroke, aspirin will help them. Give them an aspirin and it will help them recover from a stroke. And monitor them and call 911. Make sure that they get medical attention. If they have a hemorrhagic stroke, do not give them an aspirin. They already bleeding out. And you give them an aspirin, it's just going to thin their blood out, and it's going to make them bleed out anymore. And you can't possibly stop a hemorrhage after you give somebody an aspirin, a blood thinner, Coumadin, anything like that. That is a costly and fatal mistake. Do not give anybody with a hemorrhagic or any type of bleeding or bruising any type of aspirin or blood thinning substance. Alcohol, none of that. Don't do it. Don't do it. Don't do it. Please, if you don't get nothing else from me, put the aspirin down. Don't pass go. Do not collect $200. Anyways, but aspirin does help, and it can help in a preventative situation. Like, you can take it now. You can take aspirin, 81 milligrams, 1 tablet every day, just whenever you want to, or every day, basically, to prevent any plaque buildup in your arteries. That does help. And then if you don't want to take aspirin, you can take omega-3. Omega-3 is considered a blood thinner, and it also helps to decrease your cholesterol levels, your bad cholesterol levels. Vasipa, Lavazza, or omega-3 over the counter, or fish oil. Fish oil is omega-3 over the counter. Take that. I believe it's 1,200 micrograms over the counter. Correct me if I'm wrong, medical providers. I believe it is 1,000 micrograms of fish oil or omega-3 over the counter to help to reduce cholesterol levels and to help off label to help thin out the blood a little bit. And another treatment for heart disease, love one another, be nice to your neighbor, remove stress out of your life because that can cause heart problems, stress on the heart. Plant a tree, pick up trash, give somebody a compliment, do a good deed, keep your energy high, things like that. That helps to treat and prevent heart disease. What also prevents heart disease? Not smoking. Hey, you with the cigarette right behind the screen right here. I'm talking to you. Put that cigarette down. Put that Black and Mild down. Put it down right now. Go get some help. Talk to a doctor. Ask him to prescribe you some Chantix or some bupropion. Stop smoking. Limit your alcohol intake too. Change your diet. Less sodium. Stay away from canned foods. Stay away from processed foods. Stay away from salt. Stay away from salt. Salt, okay? Salt. Stay away from it. Quit adding salt to your foods the best that you can. I know, people want their flavor in their foods, and I understand, but put some garlic in your foods. Put some onion. Put some bell pepper. Put some mushrooms. Some, get less sodium ingredients. Less sodium or reduced sodium soy sauce. Reduced sodium. I believe they sell reduced, non-salted butter. Stuff that has reduced sodium in it will help you. And then not adding salt to foods when you cook will help to prevent you from developing high blood pressure, which can lead to heart problems later on. Processed foods, fast foods, stay out of Sonic, stay out of McDonald's. Please stay out of McDonald's. Wendy's, all of them. Cook more at home. That way you know what is in your food. You know what's in your food? Do you know what all is in your food? Oh, okay. Exercise. Get some cardio in you. Put some pep in you. Get 30 minutes a day of cardio, aerobic exercise. 30 minutes per day, 5 days a week of aerobic or cardio exercise. It's going to get you moving. It's going to get your blood pumping. It's going to get your arteries, your plaque broken up, and get resistance exercise, weight training 2 days a week, and stretching, balance, flexibility. Do this every day, and then do this before and after exercise so you don't hurt yourself and you recover better. Yoga, meditation, mindset change. Get stressful situations, get stressful things out of your life that will get your blood pressure up. Take stressors out of your life. Don't put yourself in situations that will put too much strain on your physical, mental, emotional health, spiritual health. Don't let anybody make you get outside yourself. Nobody at all. Nobody is worth your peace. Y'all feel me knocking? Nobody is worth your peace of mind. Nobody is worth the health of your body. I don't care. Former friends, frenemies, people who might envy me. I don't know who would envy me. You'd be surprised. I don't know, but Even family, if family, even though you've grown up with them, but you find them being the most toxic thing in your life, some things you just gotta let go. Some things you just gotta let go. I love my family. But it's people that you just gotta cut off, even if they're blood related. Blood don't always mean family, and family don't always mean blood. So know who your tribe is. Keep your tribe around you. Be around people that will help you to bring your energy up. Keep your energy high. Y'all hear me? That's a biggie. Nobody is worth your peace. Peace of mind. Peace of mind. Y'all hear me? That is the word. That is the term of the day. Peace of mind. Get CPR certified. That's a big one. Compression and pulmonary compression, pulmonary resuscitation. You're doing 30 compressions on the chest. You giving them 2 breaths in their mouth, lifting their neck up, and helping to keep them alive if they fall out, if they pass out and you don't notice, and you notice that they're not responsive. That's a big one. Get certified. There's gyms where certain CPR instructors practice and give people CPR certifications every day. Like it can be a class as little as maybe $20. It can be cheaper if you're a member at that gym that they're doing the certification at. But that one skill can save a life for sure. If you can, and if you ain't scared, get CPR certified, because if something was to happen to me, please save my life. Do whatever compressions you need to do on my chest. That way my heart can be beating. That way I got breath in my body, because I still got things to do, honey. I got things to do and I ain't done yet. I ain't done. I know I'm not done. I already know. So help me to keep me alive. I'm CPR certified. I need to get recertified before the end of this month. So I'm still certified. I just need to get recertified before the end of February, or else it will expire, and that's not a good look. No. So get that. That's important. And lastly, keep your doctor's appointments. Keep your doctor's appointments. If you know you have high blood pressure, if you know that you have high cholesterol, if you have heart problems, if you have certain symptoms of your heart, and the doctor wants you to come back in every 3 to 6 months, then keep your doctor's appointments. That way your doctor can check your heart, can check the reason why you keep getting dizzy every now and then. It could be because that you haven't eaten all day. It could be because you might have diabetes, and your sugar is too low, your blood pressure is too low. If a medical professional or a health or holistic health professional can check you and, keep up with you and keep you healthy and help you to know yourself, know your body, and you can learn to, figure out what's wrong with you, because that intuition right up in here, your intuition is never wrong. If something ain't right inside of you, your intuition, your inner gut is going to tell you. Like nobody's business. Listen to your gut. No doctor, nobody, period, who is not you can tell you what you are feeling physically, mentally, emotionally. Nobody has a right to tell you how you feel. Word of mouth. Nobody can tell you what hurts, what doesn't hurt. Nobody can tell you what is hurtful mentally, emotionally. Nobody can tell you that but you. If it hurts you, can't nobody take that from you. It's their job to acknowledge it and to help you heal. And if they can't help you, go somewhere else. Somebody will help you. I will help you. You hear me? So that's all I got. That's it. That's all she wrote. Oh, my hair is all over the place. I got all in that, honey. Ooh. I didn't got off track of my banners. But if y'all have any questions for me at all, you can email me at healthcoachree@will2well.com. You can message me on Facebook, Instagram. I'm on Instagram at healthcoachree, R-E. You can find me on Willpower to Wellness on Facebook. I am on YouTube. Like this video, comment. You can subscribe. You can follow. Hit that bell to get all notifications when I put a video on here. If I go live, if I feel like going live, if I feel like doing a pre-recording, you will get the first notification. So that's all I got. Love yourself. Love your neighbor. Love what you do. Live your purpose. Be your own tempo keeper. So if you want to buy any of my candles, I have 7 different scents that are amazing, and they can be used depending on whatever intention that you want to focus on. Send to spirit, send to the universe, send to God, whoever you pray to, whoever you honor. And these candles are very powerful. So 7 different ones. Check me out. I have the link at the bottom of this video. And other than that, I'm signing off. Thank y'all for listening. Happy Valentine's Day, Sunday. Happy Black History Month. And I will see y'all later. I'll holla at y'all.